Hello, I'm Amy Wilhelmy, and welcome to Healing is the Messy Bitch. Today I want to talk about something that we really don't normalize enough in this field, which is missteps. Not catastrophic mistakes, not ethical violations, not call your supervisor and panic moments, but the quieter ones. The moments where pacing was just a little off, timing wasn't quite right, where therapy got ahead of the nervous system, even with the best intentions. Because if you're doing real trauma work, especially integrative trauma work, these moments are not an if, they're a when. And what matters most isn't whether they happen, it's how we respond. So I want to walk you through a composite case, not to show you how to do everything perfectly, but I want to show you what ethical responsiveness actually looks like in real life. So a couple comes in, they've been together for a long time. There is love there, but there's also distance. Both partners have trauma histories, different kinds, different attachment strategies. One partner tends to shut down, the other tends to pursue. There's sexual avoidance, not because desire is gone, but because closeness has started to feel dangerous. So we start where we should start, which is attachment, right? We use EFT to map the cycle. We slow things down. We help each partner understand what's happening inside their nervous system instead of blaming each other. And things stabilize. There's less fighting, more understanding, more room to breathe. And in this stage, nothing flashy is happening. And that's important because safety isn't loud, safety is quiet. As the work continues, one partner begins individual ketamine-assisted psychotherapy alongside the couple's work. Ketamine opens up some emotional access. There's more feeling, more insight, more softness, which is beautiful and also risky. Because when access increases faster than regulation, the system oftentimes gets vulnerable. And that's where integrative work requires real humility, because everything looks ready, but looks ready and is ready are not the same thing. After a series of ketamine sessions, we decide to begin trauma processing. The target makes sense, the preparation has been done, the client wants relief, so we move into EMDR. And it's too fast. Not dramatically, not explosively, but subtly. The client starts to dissociate, not completely, but enough. And the partner watching this shift feels shut out, confused, a little scared, the room kind of tightens. And this is the moment that I want you to notice. This is the ethical crossroads, because nothing has gone wrong yet, but something is no longer right. And this is where therapists get tempted to push, to think we're already there, or this is uncomfortable, but it's necessary. Or if we stop now, we're going to lose this momentum. But ethical practice is not about momentum. It's about safety. So we pause, not because anyone failed, not because EMDR is wrong, not because ketamine was a mistake, but because the nervous system gave us this information. We slow the work down. We name what happened explicitly. We talk about the dissociation. We talk about the partner's fear. We talk about how this intensity showed up faster than the integration. And then we return to attachment safety. That choice matters, because when clients see us slow down for their nervous system, instead of pushing against it, something powerful happens. Trust deepens, not because everything went perfectly, but because repair happened in real time. And then over the next sessions, regulation returns. The couple feels steadier again. The partner who dissociated feels less ashamed. The other partner feels included rather than sidelined. And when trauma processing resumes, it's different. slower, better titrated, more embodied. The nervous system can stay present this time. Eventually, sex therapy comes back online, not as performance, not as pressure, but as curiosity. Touch becomes possible again. Pleasure becomes less threatening. The body feels safer. And this is what integration actually looks like. Not clean, not linear, not Instagram ready, responsive. I want to say this clearly, especially for the clinicians that are listening. Rupture does not mean failure. Unrepaired rupture does. Integrative trauma work is complex by nature. You are working with attachment systems, trauma memory, embodiment, and sometimes altered states all at once. If you expect yourself to never misstep, you will either rush, avoid, hide mistakes instead of repairing them. And none of these are ethical. Ethical practice is not about perfection. It's simply responsiveness. And this is why supervision matters. This is why pacing matters. This is why we don't let the excitement of these powerful tools override the wisdom of the nervous system. Integration isn't about stacking modalities. It's about staying in the relationship with the system that's in front of you. And sometimes this means stopping, rewinding, repairing. And this is not weakness, this is a skill. If there's one thing that I hope that you take away from this, it's this. Healing doesn't happen because we never get it wrong. Healing happens because someone stays when it gets messy. And yes, healing is a messy bitch, but repair is where transformation lives. And if you're doing this work or thinking about this work, stay humble, stay supervised, stay paced, and remember that the nervous system always tells the truth. Thanks for being here.